Good evening, everyone. My name is Brenda Ahlberg, Kenai Peninsula Borough Public Information Officer. And tonight we are going to provide you an update regarding the coronavirus response on the Kenai Peninsula. And joining me tonight is Dan Nelson, our incident commander, to provide us that update. And then I'll roll right into questions and answers with our community. We're calling it the community conversation. And we'll do this until about 7:30 tonight, and we will continue to answer questions for a bit in the comment string. Please bear with us as we do so. And with that, I'm going to turn it over to you, Dan. Hello.
Thank you very much, Brenda. Good evening, everybody. Thank you so much for joining us this evening. I'll provide just a very quick update, but please be sure and ask those questions, and Brenda and I are here for you to provide that information. So it was another busy day of collaboration and planning with the Kenai Peninsula Borough Incident Management Team, with all of the city and agency incident management teams that are working across the borough. You know, it's hard to see us. We're not too visible to most folks, and a lot of us are doing what Brenda and I are doing, is practicing our social distancing and being able to remote work. But all of our cities across the peninsula, as well as our hospitals, the Department of Health and Social Services, and many others, are working hard with their personnel to get these plans in place and to coordinate this response. Each morning we meet with those folks and deal with issues that come up or potential things that we can see down the road. And today's keyword was really that contingency planning. We're in a little bit of uncharted territory, of course, with how big this coronavirus is, literally a global emergency. But we are working through that contingency planning process to ensure that, you know, whatever that we can see and we can project as being thrown at us, we have a contingency plan for, and working with the cities and answering their requests and their questions and being able to communicate through the borough up to the state and back for those needs. So that really was today, and keeping track of things and keeping up with new developments. So you know, I feel confident, and definitely want to thank everybody on the Kenai Peninsula that's working on this and helping us contribute to this planning effort.
It's definitely a broad stretch. We've got all of our municipalities, tribal entities, nonprofits, healthcare industry, healthcare providers, I should say, that are truly working collaboratively to ensure that our residents are getting the information they need through us, as well as following those protocols that have been put in place by the Department of Health and Social Services. And on that note, on this end of incident management, as your information officer, we definitely received a lot of notifications from agencies today that I think are beneficial for our residents to take a gander over to our blog. It's an interagency one-stop shop of all the agencies' official messaging. That is www.kpboem.com. And it's also on our Facebook page that you're currently watching. In the header of this prompt tonight, you'll also see the address there. And Dan, I'm going to share a couple things with you that if you could help us address tonight. And one of those is in Anchorage, and I think even recently, Ketchikan also notified the residents to hunker down. And what exactly do both of those boroughs, what are they trying to tell us?
So they're really trying to push home to their residents that social distancing, that physical distancing is critical. We've heard about flatten the curve. Remember that everything that we're doing and all of the planning that we're doing is to mitigate the risk really now to everybody, our vulnerable populations, but you know, really for everybody in the community. So Ketchikan and the mayor of Anchorage basically put out those orders to, unless you have some sort of essential business duty, critical infrastructure, or grocery store, workers, food service, that type of thing, you are to stay home. You're to stay home or stay out of the way of others in crowded areas. So those two municipalities have put that out for their residents, really encouraging them to do so and putting the weight of some of their laws behind that. Here in the Kenai Peninsula Borough, we're set up a little bit differently. We're a second-class borough. So you're not going to be hearing us saying to do those same things. We don't have the authority to do so, so we can't compel our residents to do so here. But I really want to understate that even though we don't have the ability to compel our residents, that is the advice we need to all be taking right now. If you do not have essential business, if your industry or your work is essential to infrastructure and services, then by all means continue that while practicing social distancing, hand washing, and all those hygiene things we've been pointing out. But if you don't have that, it's time to stay home. It's time to hunker down, shelter in place, whatever you'd like to call it, but stay home and help us flatten that curve. Do not spread this COVID-19 around. And remember, you can be feeling fine, you could be having no symptoms, and you could still be a carrier. So really want to ask, heart to heart right now, is ask our residents to follow that advice, stay home, flatten that curve.
Thank you very much for that. And that's one of the things that is so important with regards to our younger folks who very much could be asymptomatic and not realizing that when they're visiting their older parents or even grandparents, that they're putting them at risk for potentially being exposed to this. We want to make sure that that's taken care of. Once again, I'm having technical difficulties. This happened last night as well. Stand by just a minute. There you go.
Bear with us on this
Bear
technology
with
thing.
us.
Brenda and I are getting
Exactly.
there.
We're getting there, by golly. So I'm going to move down the list as far as some of the other things that were brought up in my shop today that I found really interesting, and I certainly don't want to dismiss, is that the Alaska Department of Health and Social Services also had asked for a call for swabs. They're needing donated swabs to be brought in because of the shortage. Is that Q-tips?
No. So those nasopharyngeal swabs are a little bit different than Q-tips. They're medical grade, and you might have seen that from the municipality of Anchorage or Department of Health and Social Services. So remember, those calls were really targeted towards medical providers. So doctors' offices or dentists' offices or other medical providers may have those, and they've been asking for those donations at their testing site there in Midtown Anchorage. So we're not looking for Q-tips, not looking for those things here. If you have them as a medical professional, you might consider working with them on that. But right now, there is no call for any of those types of medical things. And Anchorage talked about that, but you've also may have seen that some people are making masks and doing some of those things, and there have been some calls nationally for things like that. And here on the Kenai Peninsula, we talked with all of our hospitals this morning. We do not have a shortage of masks at this time. They have what they need to protect their employees and their patients as they're working through this. So really want to thank everybody. I think there were definitely some people that stepped forward to the hospital and volunteered to do that, volunteered their talents. So thank you very much. Not necessary right now, but if there are calls for things that, as this situation evolves, that happens, we're going to be sure to repeat those messages on KPB alerts and kpboem.com. So basically, we're good right now. There are no needs, but keep an eye out for that official messaging.
And I have no doubt, as strong and so collaborative and supportive as our communities are, that when we make the call, people are going to rally to help each other out. And so yes, at this time, there is no need for any homemade masks to be given to either Central Peninsula Hospital or for the South Peninsula Hospital. We want to thank you again, but let's stand down until they're ready to make that call to action for us. Along those lines, there's a couple other things that were brought to our attention, and that had to do with testing and how long does it take? What's basically the procedure, and how long does it take to get testing back, which I know because it has to get flown outside and come back. That can be anywhere from 48 to 72 hours, depending on it making the flight to get out here. Can you talk a little bit about what that is?
Correct. And there is definitely some variability in what it's taking to get those tests out. So once again, if you've tuned in last night, we talked a bit about this. Just as a reminder, those tests require a referral from your healthcare provider. So again, if you're concerned, you're showing symptoms, you're feeling ill, make a call to your healthcare provider first, and they'll screen you over the phone and give you instructions. For those folks that are getting those tests, they are flown out. They are being done out of state right now. The tests in the Central Peninsula, Kenai Peninsula area. There's different turnaround times right now, and it is being extremely variable, as you can imagine. The labs that are testing for these are quite backed up. So at least 3 days. We are hearing it's starting to go a little bit more than that, perhaps into the 4 or 5 day range, but it's really a moving target. So we discussed that again this morning, and that's the best range I can give right now of an estimate. And just again, bear with everybody, as all of our systems are very, very busy with those folks in those labs. So I'm sure working 24/7 to get those things processed as quickly as possible.
So basically, you're looking at a long enough time frame that all the more reason why it supports the need for us to continue to practice this distancing, staying away from each other, 6 feet apart, washing our hands, washing our thumbs. We always forget our thumbs. That was brought to my attention again today, and practicing those protocols.
We do. That's a good point. And, remember when we talk about washing your hands, there's all kinds of tricks. They say at least 20 seconds. More is probably better to give yourself time to get those thumbs, to get all the parts of our hand. But that's the thing. This physical distancing we're talking about, it's sometimes hard. If we compare now, the last time I think we were probably doing live videos was during our winter storm or our Swan Lake fire here in the past year. It's pretty easy to see that. There's a fire, we have smoke, we've got weather. Those are the kinds of things that people here on the peninsula are used to. But this virus, I mean, we can't see it, we can't see what's happening. And all of a sudden, 2 to 14 days, we might be carrying it, we might be spreading it, we might be leaving it on surfaces, and we aren't showing any symptoms. So that's really the crux of it right there, Brenda, is what you said. We have to isolate ourselves. We have to use that hand sanitizer. We have to wash our hands many, many times a day, especially if you're outside for some reason, if you're at work, the first time you go into any place, wash your hands. You might be carrying that from somewhere else. You might have dirt, whatever it is that might be carrying it. So it's a tough thing. I mean, we all acknowledge that I think some of us like being at home, but we're Alaskans. We like being out of doors. We like doing different things. We're used to being at school and at work and at church and doing all those different things. But this is really what we need to help each other out right now.
And with that, I will say one of the things that is so great about living on the Kenai Peninsula is that I think we're only a couple people removed from knowing somebody else. And with that, you add social media to it, and we have the rumors flying. And without delaying or creating additional rumors, I do want to turn it over to you on the news that we were recently provided from the Department of Health and Social Services regarding some cases here in the Central Peninsula.
Well, thanks for bringing that up, and let me address that. So the Department of Health and Social Services notified us this afternoon that we do have some additional cases in the Central Peninsula. 2 new cases were confirmed today through testing, one in the Soldotna area and one in the Sterling area. That's really the majority of the information we have at this point. Right now, DHSS, the Department of Health and Social Services, is going through its process to get that information out, to work with those healthcare providers, and to begin their investigation, their surveillance of these cases. So there may be a bit more information coming soon from that agency, but that's what we have. So 2 new cases. This is definitely something that we need to be aware of, and just underscores the conversation we just had about those precautions to be taken. I'd really like to encourage our residents, as we've talked about a little bit here in the past nights, that, we all know somebody, we all hear things, let's not be repeating rumors and getting spun up about some of these things. We know the precautions we have to take. We know that our neighbors are in good hands with the healthcare providers here, that hopefully we'll get some good results from there and have those folks taken care of. And the other folks they may have come in contact with will be contacted through the DHSS surveillance and interview programs. So 2 new cases today brings the total in the Kenai Peninsula Borough to 3, including the one in Seward 2 days ago that was announced.
And likely we're going to see the official release from Health and Social Services here within the next hour or two. We will most certainly put it on our blog, kpboem.com. We'll put it here on Facebook as well. And we'll make sure that the official information is there for our residents to look at. And then, of course, we'll follow up with a statement that's provided by the borough on any additional information that we have as soon as it comes in. And we want to reassure our public that that's what we're here to do for you guys, is also to provide you the correct information. And would greatly appreciate it if we could align ourselves not only in the prevention protocols, but in the messaging that we're sharing with our friends and family. Because we're in this together, and we're going to help get through this together, as long as we're making sure that we have the right information out at the right time to everyone. Dan, I want to take you to some quite a few questions tonight. I'm going to scroll through here momentarily and see if I can come up with some consolidated questions that perhaps you'll be able to answer. I want to let our audience know that if we are not able to answer them, that we'll certainly try to get you the information, and we will not be able to speak on behalf of other agencies. And we are hoping that they're monitoring so that they can provide you the answers directly from those agencies. So one of the questions that's been asked, are all businesses closing this week?
No, all businesses are not closing this week. We don't have a mandate to do so in a similar way that I addressed earlier in the video, where we talked about the powers of the borough, and we do not have the ability to compel those businesses. That would rest with the governor ultimately. Now, many businesses have been adjusting their processes and practices to help us encourage that social distancing. So a great example is, of course, the restaurants and things that have converted to a takeout or a drive-through service as opposed to a dine-in service. Some of our stores have instituted some different hours for different groups and trying to do some of those things. But at this time within the Kenai Peninsula Borough, there is no mandate for those businesses. There is some in the municipality of Anchorage, that hunker down order that the mayor put out, but that applies only to the municipality, not to the Kenai Peninsula.
And I also want to add to that in one of the mandates that it did say that gymnasium or gym membership type of facilities were being asked to close. So there are, from that perspective of business, they are being asked to help slow the spread by postponing or temporarily closing so that it can help stop that spread. Am I correct, Dan?
You are, and thank you for reminding me of that. So that was focused primarily, I believe, on what they called entertainment venues. So I believe that is the gyms, like you mentioned, the movie theaters, and some of our recreational facilities, the sports centers and the hockey rinks and things like that. Again, to flatten that curve and stop the spread.
Okay. We did talk about the turnaround time on the test, and depending on where that is on the peninsula, I think you did a good job at answering that question. And there's some questions here about directly for the hospital, and don't believe that we can answer those questions, but we'll certainly try to get you some answers. We talked about the masks and how community members, we greatly appreciate that's a great idea, but our hospitals do not need any homemade masks at this time. Let's see, bear with me, please. Is the positive person in Seward is a standby just a moment, in the hospital or in their homes? Can you address that, or would you like me to?
Let me just speak to that as far as the question about the individual in Seward or even the individuals here in Soldotna and Sterling. That's not really something we can answer. The Department of Health and Social Services works with their providers and works with those patients on whatever medical care they need. But those patients are still also afforded their privacy to their own medical care. So that's not something we're going to be able to address as far as where a patient may be located, or really get into too many specifics about their particulars. So we definitely appreciate people's understanding about that. I think if it was your family or your friend, you wouldn't want those same things put out on a Facebook Live video. So your respect of their privacy and their time of medical need is appreciated.
Very well stated. And I think that is an emphasis that we'll want to end this evening with, is the privacy of those who have been impacted. And moving on, there's a lot of questions here. We're going to try to get through some of these. How are you handling cash coming into the borough? Is it being sanitized?
So when cash comes into the borough, so as a reminder, right now, most of those transactions are being put into our Dropbox or being mailed in. They are not being handled directly. As you may come up and see our cashiers at the front desk, that's not being done right now. So there's differing guidance on how this coronavirus can live on things like paper and some of those things. So what we're doing is, when that comes in, our employees are wearing personal protective equipment, gloves and things like that, so they don't come into contact with the cash or the paperwork or what have you. And they're being batched and being held for a 3-day period. That seems to be somewhat consensus right now on some of the time limits. So as we batch those things, 3 days later we'll come out, and then again we'll still be wearing personal protective equipment, and then we will process whatever the paperwork happens to be. So that's why if you make a payment with us, you might see just a little bit of a lag. It will be dated the day we receive it, but you may not see it updated in our computer systems and things, or cleared from your bank for 3 days. So there's not a specific sanitation, but it is going through a holding period.
Okay, just looking through this, there's a lot of questions that folks are wanting more and more updates about these 2 cases. And as we reiterated earlier, we are only giving you the information we have at this time. We are going to wait for the state to provide the official information that we are going to share on the blog, kpboem.com, as well as here on our Facebook page. As soon as we have the official information, we will get it to you. And going on, and we're talking about roads. Is there a mandate that says anyone traveling to Alaska from the lower 48 should self-quarantine for 14 days upon arrival? When I'm assuming on arrival of coming back to Alaska.
So on that subject, you will see, I'll just address in general terms, you will see if you are flying back via plane, there are representatives at the airports to remind you that, yes, everybody should be self-isolating for that 14 days per that health mandate. Via road, right now, the border between Canada and the US on the Alaska side is closed to non-essential traffic. So that does include visitors, tourist-related things. It does not include cargo, freight shipments, those types of things. So for right now, people aren't being allowed in through the land border if they don't have some sort of official business. Those folks are being trained by their companies, the freight forwarders and those, on the precautions to take. But the short answer is, if you are coming into Alaska, yes, isolate yourself for 14 days at home. If you are with others at home, maintain that physical distancing. Take care to sanitize surfaces within the home repeatedly throughout that period. Let that 14-day period pass. That seems to be the upper limit of when people can be asymptomatic or not showing symptoms. So once that 14 days pass, there's no symptoms, we can be assured from the information we're being given right now that you would not be a carrier or have the COVID-19 virus or a similar cold or flu infection. Definitely keep up with us, because we're getting new guidance almost daily and updates, and medical professionals and science and those folks around the world are working on this around the clock. So we get new things as soon as we do that's verified and factual information, we'll pass it on.
And talking about transportation, I want to remind folks that the Alaska Department of Transportation and Public Facilities, we call it DOTPUF affectionately down here on the peninsula, they provided an announcement that road maintenance would continue and that the state-owned airports and the marine highway system, our ferry system, is still open with, of course, the protocols in place to ensure that staff and those individuals that that are using those systems adhere to the CDC requirements. So I want to also remind folks that those facilities are still open. And also to remind people that the Port of Anchorage and cargo ships coming in are still very much functioning and being able to get into port and to process from there via truck. So you have anything to add to that, Dan?
No, I think you summed it up well, and know that again, those cargo shipments and even those cargo shipments both from marine and the port, which is the majority of them, as well as I just mentioned, those that are coming over land are being allowed through the border. So rest assured that that supply chain and those commodities are still on their way on schedule to Alaska at this time.
All right. A couple more questions here. It says on my feed, will there be a hunker down for the Kenai Peninsula? I know you addressed that a little bit earlier. Can you talk about that again for those that might have come in later today on this
Certainly,
show?
just briefly, we'll talk about that. There is no, the borough does not have the ability to order that as a second-class borough. So that's not something that would come from the borough administration or the Office of Emergency Management. So essentially, to reiterate what is happening, that hunker down order was given in the municipality of Anchorage. We strongly encourage, in absolutely the strongest possible words, stay at home, stay safe, prevent the spread, flatten that curve. Don't go out unless there's essential business or your profession is part of essential business. So there will not be an order coming out from the Kenai Peninsula Borough. However, we very strongly suggest that you heed that advice at once and stay home to help us get a hold of this.
And for a lot of our residents, that when you say borough, we have 27 unincorporated communities in the borough. An unincorporated community is not a municipality. And so those are called non-area, right? So those are the areas that the borough provides those services and functions under our code of ordinances. So I just want to make that clear for people when we talk about the borough. What is the difference between that and our municipalities? We have
So
6 municipalities here on the borough.
correct, and those municipalities are all formed under different laws as they were enacted by voters. So when we talk about municipalities such as Soldotna, Kenai, Homer, Seward, Kachemak City, or Seldovia, they have additional powers or different powers than the borough. So they have more power to regulate business and require different licensing and provide different services. So animal control would be a good example, is that many of our municipalities provide that service, while the unincorporated communities do not have that directly from the borough. The borough was formed with limited powers. That's why it's called a second-class borough. So we only have some of those things that are very clearly prescribed by law. So that's the difference between a city and the unincorporated areas.
Thank you for that. We're coming up on 7:30. And for those that we were not able to address your questions, we will most certainly try to get the information to you. If we can't, because it's directed at a specific agency, just bear in mind that we cannot answer on their behalf. We'll do our best to get you the answers as quickly as we can. We appreciate you taking the time out of your evening to be with us tonight. And again, please look at our blog. That is where all the official information is going to be hosted from all of the participating agencies. I will turn it back over to you for some closing words.
And I appreciate again as well, and everybody that joined us this evening and took that time. Remember, we are here each night at 7 o'clock for about 30 minutes to bring you up to date with the events of the day and to answer your questions and provide what you need. Please provide those in the comments. Definitely some news that came out this evening, as we've talked about what we can right now about our new confirmed cases. I just really want to reiterate that these are trying times. They're times of high anxiety. Please watch those official sources of information we've mentioned several times. You're watching it right now on this one, and make sure that you're following that information, and we're not repeating rumors or conjecture or making up things or repeating things we might have heard in other places that may not be true, or that kind of water cooler talk, as we sometimes call it, but of course not when we're social distancing. That's not good for our neighbors and our friends and our family. These folks and people that may be sick, and these cases are our neighbors and our friends. So think about how you would like to be treated if you're a member of your family was being announced tonight on Facebook Live. So with that, I want to thank everybody for being those good neighbors, for coming out and volunteering masks and all the other assistance. We're still working through many of those things, and that those updates will continue. So follow KPB Alerts, kpboem.com, and we'll see you tomorrow night at 7.
Good night.